So welcome everybody to meeting number 26 of the House of Commons Standing Committee on Health. The committee is meeting today to study Bill C-237, an act to establish a national framework for diabetes, and then proceed to the clause-by-clause consideration. After that, we will discuss the first report of the Subcommittee on Agenda and Procedure. So I want to thank the witnesses for appearing today. We have first up, of course, we will have Ms. Sonia Sidhu, MP for Brampton South, whose private member's bill this is. We also have Diabetes Canada, Ms. Kimberly Hansen, Executive Director, Federal Affairs. And JDRF Canada, we have Dave Prowden, President and Chief Executive Officer, and Ms. Juliette Benoit, volunteer. So we'll start with Ms. Sidhu. Ms. Sidhu, please go ahead with your statement.
Thank you, Mr. Chair. Colleagues, it's my pleasure to speak today on my private member's bill C-237, an act to establish a national framework for diabetes. Before I begin, I want to thank all members immensely for your support of this initiative at second reading. I'm glad to know that we shared the common goal of fighting diabetes. This year, we commemorate the 100th anniversary of the discovery of insulin by Sir Frederick Banting and his partners at the University of Toronto. It was also at UFT where stem cells were discovered in the 1960s, and these have led to promising research that may lead to a cure. Since Canada has been the home of these great inventions in the fight against diabetes, it's also right that we should have a comprehensive strategy to help those living with this disease. 11 million Canadians are living with diabetes or pre-diabetes. The number of diagnoses has doubled in the last 20 years, and every 3 minutes, another Canadian is added to this list. In my own community of Brampton, almost every 6th resident lives with diabetes or pre-diabetes. In my 18 years career as a healthcare professional, I would see patients with cardiovascular disease, kidney disease, amputation, or high blood pressure, and diabetes was frequently an underlying and that's why a strategy is so important. By effectively fighting or preventing one disease will make an impact against many others. When you consider the expense of the public healthcare system and to individuals living with diabetes, it represents a massive financial burden. Every dollar spent fighting and preventing diabetes means greater saving down the line. It is one of the most common chronic illness in Canada, and the rate of only growing. Some Canadians are at increased risk of diabetes, such as South Asians, Black, and Indigenous Canadians. We also know that diabetes disproportionately affects Canadians with low income and education. Diabetes rates are 3 to 4 times higher among First Nation than among the general Canadian population. Furthermore, Indigenous individuals are diagnosed with 2-type diabetes at a younger age than other individuals. The COVID-19 pandemic has disproportionately affected Canadians with chronic diseases, including diabetes. For all these reasons, we need a cohesive national plan to respond to diabetes, one that coordinates funding to awareness, prevention, research, and treatment, and ensure equal access to treatment across Canada. Mr. Chair, we can learn from Canada's past diabetes plan and programs and make sure that the framework called for in C-237 is data-driven, accountable, and engaged with stakeholders such as Diabetes Canada, JDRF, and others. A national framework for diabetes would provide a common direction for all stakeholders to address diabetes and by extension, other chronic diseases with the same common risk factors. It would enhance coordinated efforts across federal, provincial, and territorial jurisdictions and provide a mechanism for tracking and reporting on progress. The framework would allow for the identification of gaps in present approaches, strengthen action to address health inequities in diabetes, and decrease the duplication of efforts by coordinating across jurisdictions. The bill calls for promoting research, data collection, and treatment. It would offer an opportunity for Indigenous people and organizations to be engaged in federal, provincial, and territorial strategies using a distinctions-based approach. It would make a difference in the lives of millions of Canadians. Back in April 2019, this committee conducted a study and released a report on this very issue. Mr. Chair, Mr. Davies, you were both part of the committee at that time. The comprehensive report already outlines the steps that the government should take in the fight against diabetes. The number one recommendation in this report was the Government of Canada, in partnership with the provinces and territories and in collaboration with stakeholders, plan and implement an approach to the prevention and management of diabetes in Canada through our national diabetes strategy. Bill C-237 mandates the minister to do just this. The HESA report made 10 other recommendations. Among them were that the government explore options to reduce diabetes-related stigma and options to improve public awareness and education on diabetes, provide funding through the Canadian Institute of Health Research for research into preventing and treating diabetes, hold discussions with the provinces and territories to explore possible approaches to providing uniform coverage for diabetes-related medications, supplies, and equipment across Canada, work with the provinces and territories to explore possible approaches to improve access to healthcare for individuals living with diabetes in rural, remote, and northern communities, and to address the difficulties faced by many Canadians in accessing a family physician, and to work with the provincial regulatory bodies to ensure that healthcare professionals receive comprehensive education and training to properly identify and manage diabetes and diabetes-related complications in their patients. I believe that more coordinations between all levels of government and stakeholders will be a better position to win the fight against diabetes. I know that the government will give full consideration to the HESA report and the dozens of witnesses who shared their expertise and experiences to help shape the recommendation, such as the Diabetes Canada 360 proposal, which I personally think that is an excellent one. This past November, I went to the Banting House in London, Ontario, where the Flame of Hope, a perpetually burning torch that served to honor all who have been affected by diabetes, is located. It is a reminder that we must still work for a real cure, and it will only be extinguished when one is discovered. The discovery of insulin is remembered as one of the greatest medical achievements of the 20th century. It was the first time the Nobel Prize for Medicine went to someone outside Europe, and it went to Canada. The best thing that we can do as a country to honor this discovery is recommit to helping everyone battling this chronic disease, whether they are patients, doctors, researchers, or loved ones. Mr. Chair, fellow committee members, Canadians have always been leaders in the fight against diabetes. I want to thank you all again for the support you have shown for this bill, which I hope will eventually lead to the day when we can extinguish that torch at the Banting House. Canada gave insulin to the world. Why we cannot lead the way? Thank you, Mr. Chair.
Thank you, Mr. Du. We will go now to hear from from Diabetes Canada, Ms. Hansen. If you go ahead with your statement, 6 minutes, please.
Good afternoon, committee members. I'm grateful to be living and working on the traditional lands of the Haudenosaunee, Anishinaabe, and Algonquin peoples. Je voudrais commencer par vous remercier pour l'occasion de comparaître aujourd'hui.
I'd like to thank you for having me here and for the work you're doing to improve and to protect the health of Canadians.
I'm prouder to be a Canadian than during the last year. Witnessing our elected officials work together in challenging and ever-changing circumstances to help Canadians weather the COVID-19 pandemic has been inspiring. My proudest Canadian moment, though, might be when, earlier this month, members of Parliament from all parties unanimously voted in support of MP Sidhu's Bill C-237, As someone who has lived with diabetes and several of its complications for 25 years now, and who has lost many loved ones to its consequences, it was powerful to see every MP acknowledge that diabetes is a serious problem in Canada and one we must take bold and urgent action to address. In 2019, this committee studied diabetes strategies in Canada, as MP Sidhu mentioned, and recommended that the Government of Canada, in partnership with the provinces and territories, and in collaboration with stakeholders such as Diabetes Canada, plan and implement an approach to the prevention and management of diabetes in Canada through a national diabetes strategy, as outlined in Diabetes Canada's Diabetes 360 framework for a diabetes strategy for Canada. The partnership should facilitate the creation of Indigenous specific strategic approaches led and owned by any Indigenous groups wishing to embrace this framework. Those were your words, committee. You recommended this because you recognized that countries with a national framework or strategy to address diabetes do better. Leur prévalence du diabète est plus faible et
the prevalence of diabetes is lower, and people living with it suffer less of its complication. That's why they are the organization.
And in the 8 years since Canada last had a national diabetes strategy in place, nearly 2 million Canadians have received a diagnosis of diabetes. That is why Diabetes Canada, our colleagues at JDRF who are here today, and the community we represent feel such a strong sense of urgency that Canada act to reduce the burden of this disease on Canadians. With someone new diagnosed every 3 minutes in Canada, at least 12 preventable lower limb amputations occurring every day, as well as 20 more deaths, we don't have a moment to waste in embracing Bill C-237 and implementing a nationwide approach to preventing type 2 diabetes and all diabetes complications. The COVID-19 pandemic only heightens that sense of urgency. People who have diabetes have been shown to be at least 3 times more likely to die of COVID-19 than someone who does not have diabetes. Emerging research suggests that COVID-19 infection may be triggering new cases of diabetes, and the economic insecurity and physical inactivity triggered by the pandemic has put many of us at greater risk for type 2 diabetes and its complications. People living with diabetes are significantly more likely to struggle with mental health challenges, including depression and anxiety. COVID-19 has also exacerbated that risk. I have barely left our home in more than a year now because of the risk if I catch COVID-19. And I know that many of my friends and colleagues living with diabetes are in the same situation. The sense of isolation and worry that all Canadians are experiencing during these times is powerful and adds to the mental and emotional burden of living with diabetes. During COVID-19, many people are delaying accessing healthcare, and that appears to be increasing the risk of diabetes complications such as blindness and lower limb amputation. As Dr. Karen Cross said at the most recent meeting of the All-Party Diabetes Caucus, if diabetes before COVID-19 was the earthquake, COVID is the ensuing tsunami. We must act now to minimize the impact of the tsunami of diabetes and diabetes complications that we are facing. Le projet de loi C-237 améliorera la prévention et le traitement du diabète, favorisera la recherche essentielle sur le diabète, améliorera la collecte de données et s'attaquera aux inégalités en matière de santé. Il exige que le ministre de la Santé dépose devant la Chambre des communes un cadre national pour le diabète dans un délai d'1 an. Bill C-237.
A national framework.
Which was developed in collaboration with more than 120 stakeholders and has strong support not only from the entire diabetes community, but also from other key health stakeholders, including the Canadian Cancer Society and Heart and Stroke. Diabetes Canada encourages that when Bill C-237 becomes law, the minister refer closely to the Diabetes 360 strategy in preparing Canada's new national diabetes framework. When Bill C-237 becomes law, Diabetes Canada will be pleased to collaborate with the government to define the national diabetes framework and to implement governance and evaluation mechanisms and supports for intergovernmental collaboration to ensure that it quickly benefits the maximum number of Canadians possible. That is why Diabetes Canada strongly supports Bill C-237 and congratulates MP Sonia Sidhu for her leadership in tabling it and for her commitment to our cause. We urge Parliament to pass this legislation quickly so that we can begin implementation as soon as possible, which is what Canadians want. In an Ipsos poll conducted in November of 2020, 86% of total respondents and 91% of BIPOC respondents urged the federal government to embrace a national diabetes strategy urgently. This year, Canada and the world are celebrating the 100th anniversary of the discovery of insulin by scientists at the University of Toronto. This momentous discovery saved the lives of millions of people around the world and is rightly recognized by most Canadians as one of our proudest achievements. By passing Bill C-237 now, the federal government can make a fitting recognition of the significance of this anniversary and begin to reap the human and financial rewards of a nationwide approach right away. Je vous remercie de votre attention.
Thank you for your attention.
Thank you. We will go now to the JDRF Canada. Please go ahead with your statement. 6 minutes, please.
Thank you, Mr. Chair and members of the committee. And I'm joined today by Juliette Benoit, a JDRF youth advocate who joins us from L'Assomption, Quebec, and will speak to the lived experience of type 1 diabetes. Just as background, Juliette was one of our 2 youth co-chairs during our Kids for a Cure this past November and would have met some of you during those sessions. So we're pleased to speak today in support of Bill C-237, the National Framework for Diabetes Act. JDRF is grateful to Ms. Sidhu for her leadership in introducing this bill, as we are for those MPs and other diabetes organizations like Diabetes Canada who worked hard to develop a diabetes strategy for Canada. Our mission is to accelerate life-changing breakthroughs to cure, prevent, and treat type 1 diabetes and its complications. And type 1 diabetes causes the body's immune system to attack and destroy insulin-producing cells in the pancreas, making children and adults dependent on daily injections or infusions of insulin for life. And as others have noted, 2021 marks the 100th anniversary of the life-changing discovery of insulin, rightly celebrated as Canada's gift to the world. But as Banting himself said, insulin is not a cure. And the incidence rate for type 1 diabetes is growing at over 5% a year in Canada, higher than the global average. And the incidence rate for type 2 diabetes is growing even faster, as is the proportion of annual health budgets taken up by diabetes. Therefore, JDRF would like to encourage the passage of its bill, and it will be critical that all levels of government work together to make this diabetes strategy impactful by fostering conditions that prevent diabetes and take actions to keep diabetes healthy, such as finding ways to make diabetes technologies more affordable and accessible as they're priced out of reach for many working families. For type 2 diabetes, prevention means lifestyle interventions. And for type 1, prevention means investment in new research into the autoimmune response that causes it. And I'd like to take a moment here to acknowledge the JDRF CIHR Partnership to Defeat Diabetes, a remarkable collaboration between JDRF and the Government of Canada, which is up for renewal this year. Launched in 2017 with $15 million of funding through the CIHR and matched with $15 million from JDRF, this partnership is funding critical research to prevent diabetes complications and investigate groundbreaking immune therapies and stem cell-based cures. It's important, too, that we focus on our resources on psychosocial support, as Kim Hanshin just mentioned. And because we can't change what we don't measure, a robust strategy needs to track outcomes for both types of diabetes through a registry, repository, or both. And now I'd like to turn it over to Juliette to talk about the urgency for a national diabetes strategy.
Merci, Dave. Bonjour à tous. Je m'appelle
Thank you, Dave. Hello, everyone. My name is Juliette Benoit. I work in Quebec, and I've been with the group for 5.5 years. When I was 11, my life changed. Shortly after Halloween, I was diagnosed. And in fact, it's rather unusual that children ask to stop eating Halloween candy so they can go to the bathroom. I was going to the bathroom often. I lost energy. My loved ones started to really worry, so my parents brought me to the hospital. I remember that the nurses and hospital staff were trying to help me and care for me, but I was very anxious. Finally, I was diagnosed with 3 words: type 1 diabetes. It took a lot to get used to my new diagnosis, My parents and step-parents were all seated around the same table, which was rare, and they were telling jokes to try to make the situation a bit lighter for me. I was given injections. It was difficult. I was a child, but I had to be very mature like an adult. It felt awful for me as a child. I was told to stop eating candy, and I was told that I'd have shots every day. It felt terrible. Now I have an insulin pump, so I can get my insulin without shots. I also have a monitor, so I know my insulin levels and I can adjust my doses. This technology makes my life easier, but it's not a cure. I still spend a lot of time in my everyday life managing my diabetes. For example, before, during, and after physical activity or sports, I have to look at how I'm feeling and what I'm eating and make adjustments. This is why C237 is important to me. I want research to continue so that we can work toward finding a real cure. We need support from provincial governments and from the federal government to make insulin pumps more affordable. Diabetes is a challenging diagnosis, and it's also an expensive one. We need resources to deal with the stress associated with living with diabetes. And we also need more education so that type 1 diabetics aren't asked questions like, did you get diabetes because you ate too much sugar? When I was 11 years old, I became strong. I became a warrior. I hope that this act to establish a national framework for diabetes will pass so that we can make real improvements.
Personal and powerful story. And as Juliette has made clear, diabetes is a relentless 24 hours a day, 7 days a week, 365 days a year disease. And passing this bill will create a framework for national diabetes strategy leading to tangible interventions with real health outcomes. It will mean easier, healthier, and safer lives for Canadians living with diabetes, like Juliette. And I can't think of a better way to honor Banting and Beth's legacy. Thank you.
Thank you all. We will go now to questions. We will start with Mr. Dontimo, please. 6 minutes. Go ahead, please.
Merci beaucoup, Monsieur le Président. Premièrement,
Thank you. Thank you, Chair. First, I'd like to thank Juliette for speaking to us. I cannot imagine what it's like to be 17 years old and speak to a committee like ours, because I'm 51 and I find it hard to present to committees. Also, the interpreter would like to signal that the sound has cut out, has now returned. So now it's been 5 years that someone I love has type 1 diabetes. He was diagnosed at age 17. Sorry, Mr. D'Entremont. The interpreters had a difficult time hearing you.
can you let me just put it on mute and put it on and off here just to be sure here. All right, hopefully that's better. Can you hear that better?
I think so, yes.
All right, so we'll go with it from here. I'm going to say thank you to Sonia for bringing this bill forward. As a parent of a type 1, and as I was saying to Juliette, my son was diagnosed 5 years ago. He just became a sort of a 5-year. You should get a pin, 5-year pin, 10-year pin. And Kim's agreeing with me here. And it is difficult. And Juliette brought up something very important here. Not only we're continually as parents or as patients trying to find ways to manage the disease, but in the back of our heads, we have to find that way to, work towards the cure. That's why I think it's a great balance today to have Diabetes Canada here and also JDRF, because it does talk about the research component with it. So again, here we are talking about diabetes, something that's very close to my heart. My question to Sonia, though, is as this bill comes forward, it talks about lots of great ideas that we should work together. We should have a national framework for this. But who's going to enact it? Once MP CEDU is finished with this, it passes in the House of Commons. Who is supposed to enact the bill or what the bill is asking for?
Thank you, Mr. Jantmont. I was listening to your speech in the House when you're expressing as a parent, you are explaining Andre's situation, and I would agree with you. In 18 years, when I was a health expert, I saw many parents like that. That is why I want to, who is addressed? It addressed to all demographics. And I would expect the federal government would take a role in coordinating that data collection, promotion of information, to encourage prevention and providing funding to research that will lead to a cure, and ensuring an affordable and reliable supply of treatment and devices. I would expect that a framework would include clear directions on which department and levels of government would be responsible for implementing the various aspects of it through education, through awareness. What it does, it will set up even delay the onset diabetes. I'm talking about type 1. Type 2, it will prevent from type 2 for the risk factor, obesity, many others. Thank you.
Okay. Thank you very much for that, because this is the confusing part, and I'll probably go to Ms. Hansen in a few moments on this one. But the challenge we have is that we have a federal government. This is a federal government bill that talks about a national or federal framework for this, but we have provinces that are responsible for healthcare in Canada. So they're taking care of their populations. So Diabetes 360 has been around for a while. So maybe, Kim, you can give us an idea, how long has Diabetes Canada been talking about Diabetes 360, and what kind of uptake have you got at this point beyond Ms. CEDU's bill?
Thanks so much, MP D'Entremont. Those are excellent questions. We developed Diabetes 360 beginning in September of 2017, and are really pleased to kind of see that the discussion carries on today. We would love to be able to kind of cap that off with a formal commitment to a national diabetes framework, such as this bill proposes. We have, as you I believe are aware, we have strong support at the federal level thanks to this committee. The Finance Committee has also recommended the strategy 3 times in a row, but we have, importantly, really strong engagement from the provinces and territories. In November of 2020, Diabetes Canada convened a second roundtable that had representatives from every provincial and territorial government, as well as the federal government, in attendance. And really the strong consensus from provinces and territories was that they are committed to working as much as they're able towards implementing provincial or territorial diabetes strategies, but they see the need for a coordinated approach, for a common framework and language, for a way of sharing best practices, and they would look to the federal government to provide that as soon as possible. So in response to the question that you just asked MP CEDU, I would agree with what she said, and I would encourage that the government, when this bill passes and receives royal assent, give strong consideration to implementing a multi-sectoral and multi-level of government advisory committee or governance structure that features representatives of the provincial governments who you're absolutely right are going to have to implement the treatment-based approaches involved in this framework, and also patient groups.
Thank you, Mr. D'Entremont. We go now to Mr. Van Bynen, please. Go ahead, 6 minutes.
Thank you, Mr. Chair. And I want to start by saying congratulations to my colleague, Ms. CEDU, for the unanimous passing of her private member's bill. Sonia has been a strong advocate for Canadians with diabetes, and this bill is key to support and improve access to the prevention and the treatment for Canadians. I was proud to jointly second this PMB, and I'm looking forward to seeing the framework come to fruition and learning more about the work involved today. Ms. CEDU, Your part of the PMB states that the government must work with the provinces and the territories, Indigenous organizations, and key stakeholders to strengthen efforts. Can you tell the committee whether this work has begun and what does that entail?
Thank you, Mr. Van Byen. It's a great question, and thank you for your support all the way. You're right. We need to consult with the Indigenous stakeholder as well, because as you know, on reserve, in Indigenous population, and there's more high rates than any others. And we need to consult with Indigenous stakeholder, province and territories. The government needs to consult with the stakeholders, such as Diabetes Canada, JDRF, and listen to the proposal, as Ms. Hanson mentioned, as Diabetes 360, which I strongly, we all supported in the HESA committee, and then Diabetes 360 has very good aspects, which we and like I hope 360 address all many indigenous concerns as well. While there have been consultation on subjects which help those with the diabetes, like there's other aspect. Canada Food Guide, has not been the national holistic consultation called for in my bill. That is why my bill called for that, and it would bring together both level of government and Indigenous partners and other stakeholders, with the common goal of creating a national diabetes strategy, which I'm asking for my Bill C-237. And it also address all Canadians' different ages, demographics, and sensitive cultures and socioeconomic backgrounds too.
Thank you. That's a good transition. Ms. Hanson, when HESA was studying the diabetes strategy for Canada in 2019, you appeared as a witness on behalf of Diabetes Canada. As part of the study, the report issued and it outlined a number of recommendations from the government. Can you tell us if any, and how the recommendations you have made has helped shape this PMB, this private members bill?
I like to think that the study that the committee conducted has informed this private members bill in a number of respects, MP Van Byen. And I think that the study overall affirmed that we have a problem and that we need to do something much more coordinated in order to address it. I see in this bill the comprehensive, holistic approach to addressing the problem that is proposed in Diabetes 360, the focus not only on prevention, but also on treatments specific to diabetes. I see the focus on measurement, which is critical. Unless and until we can better quantify the burden of diabetes in Canada, we will continue to fail to reduce it. And also the strong emphasis on addressing health inequalities, which we know exacerbate not only the burden of COVID-19, but also of diabetes. So I think that when I read MP Sidhu's draft bill, I was very heartened to see how much it is in alignment with Diabetes 360. And I think that the passage of this bill into law will strongly advance our requests for a nationwide diabetes strategy.
Thank you. Mr. Proden, you also appeared as a witness back then on behalf of JDRF Canada. I'd like to ask you the same question, please.
Well, I don't want to repeat what Kim said, but I think what we recognize is there's a lot of, I guess, the need for good data is critical to turning in the ship around and the way I would look at it. And, for a simple example is, if we don't know who has type 1 and type 2, right, we actually aren't, and some of our provincial and territorial health records don't actually distinguish. So if you don't have base level information, it's then very hard to make decisions to reshape the system. So I think that those sorts of fundamental pieces of information are critical to how we actually can enact a program going forward. And then so information leads to better decisions at the provincial and territorial level. And that's why I think there's probably an overlap between what the federal role can be and the provincial and territorial level.
Thank you. So So since the start of the pandemic, we've heard about the importance of data sharing in the medical field. And more specifically, we heard that there's a need for greater Canada data sharing, as you've alluded to. And while we've mostly heard that in the context of COVID-19, I'm wondering if yourself, Mr. Proten, or Ms. Hansen could share with us if this is needed in diabetes as well. And if so, would a pan-Canadian mechanism for data and how would a pan-Canadian mechanism for data sharing benefit the efforts to prevent and manage the disease across the country?
Maybe I can start quickly.
Sure.
And Dave, I know you'll want to talk about the registry rather, but today in Canada, we can't tell you of the number of people we know have a diagnosis of diabetes, how many have type 1 versus how many have type 2. That's very, very basic and fundamental to understanding different treatment pathways, drug pricing and usage. And so unless and until we can create some kind of a national data repository that allows us to amalgamate and understand data that shows us the picture of diabetes in this country, then really we're kind of throwing spaghetti up on a wall and hoping it's going to stick where it concerns developing treatment protocols. Obviously, provinces need to have jurisdiction over the healthcare system within their regions, and we completely support that. But the federal government could play a critical role in compiling data that would help us better understand the picture of diabetes at a national level, and that would help provinces and territories better put into context their own perspectives. So we think that data is a critical underpinning of this strategy. Dave, did you want to add?
I was just going to make one point that I think we have a very unique opportunity with diabetes because there's devices like continuous glucose monitors and pumps, and they can feed data into the clinician. And so treatment decisions, so we've talked a lot about virtual care during COVID. So that's one big opportunity, but also that data could then be amalgamated, right? So you could actually start using data that's being generated from patients every 5 minutes, literally. And so I think it's a really significant opportunity in this disease to compile this data and make really important decisions.
Thank you. A problem well defined is a problem half solved.
Thank
Mr.
you,
Chair?
thank you, Mr. Van Bynen.
Okay. Thank you.
Nous allons maintenant, Monsieur Thériault.
And now, Mr. Thériault, you have 6 minutes. Thank you, Chair. First, I have a question for Juliette. Juliette, your speech was very interesting. Thank you for taking the time to come and tell us about your experience, which is similar to the experiences of so many other young people and adults even. It was very touching to listen to you speak. What are chronic diseases? Well, with chronic diseases, sufferers have to, or patients have to learn to live with it. They have to learn to cope. And these types of diseases, they become part of our everyday lives. When someone lives with type 2 diabetes, for example, it has so many impacts on lifestyle and on everyday life. The patient really has to take responsibility for his or her condition. Juliette, you talked to us about stigma and about incorrect perceptions. Sometimes people think that chronic disease patients are in some way responsible, like that they've had poor lifestyle habits. We need to do a lot of education to prevent that. And I think there isn't enough of that. When diseases are more long-term or more silent, when they're hard to understand, diabetes, for example, it's not like a heart attack. You know, a heart attack that people understand that. They think it's dramatic. Sometimes with diabetes or other more silent diseases, individuals learn to live with them and people around them sort of forget about it. Here's what I find interesting with about the member Sidhu's work. For years, there have been talks and meetings about national strategies, national frameworks. In fact, there have been talks about this since 2005, based on what I've read. Then there was Diabetes 360 since about 2018. What we need, though, is a bill, an act. We need the legislative will and intention to act. Ms. Sidhu, a question for you. Can you tell us, please, how we've gotten to where we are today? Why today, not in 2018 or 2005? Why is it essential today that all these talks become a framework?
Why it is important, as I mentioned even in my speech, in my home riding in Brampton, 1 in 6 Bramptonians are living with diabetes, and many more are pre-diabetic or undiagnosed. And as I know, Brampton is a home to a large South Asian population, which is impacted by diabetes. And we also have a large Black community, which is twice as likely to have a diabetes. The number of people in Peel region living with diabetes doubled between 1996 and 2015. That is a data shows there. And that is why Brampton City Council is very supportive. They know that what's happening on the ground. That is why they endorsed my bill. And it is so important, the programs and whatever is not working well. We need this strategy. As Diabetes Canada, we did last term. Mr. Chair and Mr. Davis was there when we did a diabetes study in a HESA, last HESA. And then we did a recommendation. And there are always other factors like genetic, environment, type 2 diabetes, often preventable with healthy eating, active living, with education, with awareness. That is why if someone is aware with the early signs, and that one maybe he can prevent from this disease. Maybe they can delay onset disease. So long-term consequences is more dangerous. That is why, and the culture sensitivity is another thing. So that is why it's so important to bring this strategy now.
Yes, but what you say was also true in 2018 and in 2005. Now it's 2021. This bill would lead to a national framework. How do you distinguish between, what's the difference, in fact, between a national framework and a national strategy? Ms. Hansen, would you like to comment?
Yes, thank you, Monsieur Thériault. I think there's no difference between a national framework and a national strategy. When we were drafting Diabetes 360, we debated strongly which words to use to describe what we were trying to accomplish. And so it is Diabetes Canada's fervent hope that when Bill C-237 passes into law, the framework that it requires to be tabled before Parliament will be heavily inspired by or informed by the Diabetes 360 strategic framework, is how we've often called that. I think that I can't speak to why we find ourselves in the position that we do in 2021, but I can say that we've seen in the case of other illnesses or disease groups, such as cancer, that when we take a coordinated approach, when we help facilitate information sharing and the sharing of best practices across jurisdictions, we can materially improve the healthcare of Canadians and really make a difference in reducing the impact of these diseases. And so the time is, I would definitely agree. It's past time that we acted, but the only time we have is now. So let's act now to embrace this bill and move forward.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault. Yes, and this is why we need a legislative framework now. Thank you, Mr. Thériault.
We go now to Mr. Davies. Mr. Davies, go ahead, please. 6 minutes.
Thank you. I'd like to thank all the witnesses for being here today. Ms. Hansen, I think it was you that mentioned that the funding for the Diabetes 360 has been recommended 3 times in a row, and I understand it's being recommended again in the 2021 budget. Has the federal government approved funding for the Diabetes 360 strategy yet?
Not as of yet, MP Davies, no.
Thank you. And you're familiar with the HESA recommendations done by our study. I think those recommendations were unanimous by this committee in the last parliament. Have any of those recommendations as a result of the diabetes strategy been implemented by this government yet?
Not that I'm aware of, sir.
Thank you. Now, Ms. Hansen, when you appeared at this committee on October 2nd, 2018, for that study, you pointed out very clearly the out-of-pocket expenses that many people suffering with diabetes have to pay. In fact, it's over $1,500 a year, which has been deemed catastrophic. Idea what proportion of Canadians living with diabetes cannot adhere to their therapies because of cost?
Certainly. According to some research that we have done, at least 30% of Canadians living with diabetes report being unable to adhere to their prescribed treatment regimen due to its costs. And I see that problem is only really being exacerbated as time goes on. The gap between people who can afford, by virtue of private insurance or other means, the best therapies, and those who cannot afford anything but the very most basic therapies is only growing. And that's why, according to Diabetes Canada, it is critical that every Canadian living with diabetes have access to the care, certainly, but also the medications, devices, and supplies they need to live well and protect their health.
And you say that's about 30% of people living with diabetes that have difficulty meeting those needs. Yeah. Mr. Proughton, I think and other members of this committee have all had extensive dealings, I think, with juvenile diabetes, and you've done an excellent job bringing the realities to our attention. I know that there's children who have to check their blood glucose levels, an unbelievable amount of times per, every 5 minutes. And so I know that continuing glucose monitors, insulin pumps, and insulin are critical. Given that 2021 marks the 100th anniversary of insulin in Canada, do you believe that we should mark this occasion by ensuring that the insulin and the other necessary equipment, like pumps and monitors, are available to every Canadian through a national pharmacare program?
Well, I mean, everybody should have exactly what they need to manage their disease. There's no doubt. And I would then say we need to do more research to find the next level of treatments and, in essence, to cure this disease, right? So there's a lot of people that need better care right now.
Thank you. So, Ms. Sidhu, to you, a couple things. I totally congratulate you on this bill, and I admire your initiative. But I must say that that delivering the Diabetes 360 framework and funding it and making sure that all diabetics and frankly, every Canadian that needs access to medication is something your government can do. And I'm just wondering, have you gone to the health minister and asked her to simply implement the Diabetes 360 program instead of having this have to be pushed through a private member's bill that we all know can take a lot longer and may or may not get us where we want to go as quickly enough? I mean, your government has the power to do this now. Have you brought that to the health minister's attention and asked her to do so?
Thank you, Mr. Davies. First of all, I really want to say thank you for your support. And personally, I support 360. And as a chair of All Party Diabetes Caucus, we work together. And last term, when we study on that diabetes issue, we all supported that 360. And the government, of course, needs to conduct their own consultation and stakeholders engagement. But Diabetes Canada has done great work in putting together their 360 strategy.
So can I interrupt you, Sonia? Can I ask you, why isn't your government implementing it then?
So that is why C237 is a pathway towards a strategy. And Diabetes 360 is an example of such a strategy. It is appropriate to tell Health Canada what should be implemented at this point. But I took is an excellent and well and research plan, and we must let Health Canada to look at it for implementation. That is why it's a pathway. And I know Diabetes Canada, they're working well together with us, and that is why I brought C237.
Right.
And we need that strategy. And I personally support Diabetes 360. And the next level, maybe that is why C237, I brought that. We need a strategy. I
understand, Ms. Sidhu, but that's not the question. I understand you support it. The question I'm asking is why your government doesn't, because they could clearly implement this now. And for the record, the NDP believes this should be implemented now. Consultation is not necessary. These are excellent recommendations. People are dying and living with a lot of pain that is unnecessary, and we believe this should be implemented right now. Thank you, Mr. Chair.
Thank you, Mr. Davies. So that brings our first round to a close. I really don't think we have time for a second round. Is there any will for like a 1 minute round of 1 minute for each question or each party? I see Mr. D'Entremont is nodding his head, so let's do that. Let's give everybody a 1 minute round. We'll start with Mr. D'Entremont.
Well, let's ask the quick question on that one. It's just, and this is to Ms. Hansen, how much would Diabetes 360 cost in today's dollars? I know it's been around for a number of years. How much would it cost Diabetes Canada to implement such a strategy?
Implemented the way that we have recommended, which is just one possibility, it would take us 7 years. It would cost a total of $150 million over that 7 years, and it would return savings to our economy of $20 billion in that same time frame, 11 of which would be to health systems and $9 billion of which would be to Canadian employers.
How much, how many meetings have you had with either ministers or PSs over the years to try to bring this message to them?
More than I can count.
All right. Well, the PS is hopefully listening here too. So thank you.
Thank you, Mr. D'Entremont. Go now to Ms. O'Connell, please. Go ahead. 1 minute.
Thank you, Mr. Chair. Thank you, everyone, for being here. And Juliet, in particular, thank you for sharing your story about the stigma, because I think we can't lose sight of that. A very limited time. I just want to follow up on the previous comment about why not just have the government implement it. Well, then why not just get rid of private members' bills? This is absolutely a member's prerogative to move forward with issues that are important to them and their constituents. And I think that's what we should be debating here today. So the question I have for anyone who wants to jump in of the witnesses, is there a framework? Is there a country with a framework that you think have done it quite well and how it's been implemented? So maybe if you could just speak to some of the comparators around the world. And thank you, Ms. Sidhu. Congratulations on bringing a PMB forward.
Excellent question, MP O'Connell. Maybe I can start and Dave, you can add. There are a number of countries, I'm thinking specifically of Sweden, Denmark, Finland, the UK, New Zealand, who have parts of these nationwide diabetes approaches and are experiencing much better rates of prevalence and lower costs than we are as a result. In fact, Canada is in the worst third of OECD countries for prevalence and cost of treating diabetes, largely because we haven't had such an approach. Even countries such as Portugal and India have more coordinated approaches and better experiences of diabetes according to many metrics than Canada does. So as I mentioned in my earlier remarks, it's a recommendation of the World Health Organization that every country have a nationwide approach, and it's one that I think Canada should seriously heed.
Thank you, Ms. O'Connell. Monsieur Thériault, c'est à vous maintenant une minute.
Mr. Thériault, vous avez you have 1 minute. Yes. All my questions were related to the fact of saying that we'll have a legal framework. Mr. Broughton was saying it will be interesting for research, especially about data collecting that will be more effective. That's great. About the strategies, as I understood from Mrs. Hansen and from Juliette, that it will help us also to actualize all the thinking and all the strategies that were implemented in the last few years, especially Diabetes 360 program. I understand that this will be the bill will be the entry door of actualization for the 50 million that will allow economies savings of 20 billion. Everybody agrees with this. So now we have to realize to make these recommendations. We have a framework. It's quite vast, but it's full of good intentions. Everybody supports it. I trust the people who say it, who have been working for years in this field. So for myself, I can be happy with this initiative, and I congratulate Madame Sidou's intention. Thank you, Mr. Thériault.
Je vous entends pas, Monsieur le Président.
I can hear you, Mr. Chair.
Sorry, we go to Mr. Davies. 1 minute, please.
Well, thank you. And I just want to take a moment to congratulate Diabetes Canada and JDRF Canada for the wonderful work in explaining the public policy reasons. From my understanding, implementing the Diabetes 360 strategy not only will save our country money in the healthcare system over time, not only will it save Canadians' lives. I note that the Canadian Federation of Nurses Unions found that cost-related non-adherence results in deaths of some 270 to 420 Canadians with diabetes every year. Not only do we know that many children can get access to the tools that they need, I think these are known, but if I understand Ms. Sidou correctly, she suggests Health Canada will have to do some consultation on this bill. So Ms. Hansen, do you see any real areas of uncertainty or consultation that are still required that would justify the government not being able to move on this right away?
It would be my hope, MP Davies, that consultation would be focused on clarifying governance structures for carrying forward the implementation of this framework, as well as kind of defining the specifics of how all levels of government can collaborate in implementing it. So I would hope that, the extensive work that JDRF and that we have done to bring the community together to define what should be in the framework can stand, and therefore that the focus in the months after this bill passes into law can be on how can we start actually implementing it as quickly as possible. We can't wait really another moment.
Thank you.
Thank you, Mr. Davies. And that brings our questioning to a close. And I thank you all. I thank the witnesses in particular for their testimony today and for sharing your expertise and your time with us. And with that, we will suspend and invite the witnesses to withdraw, and we will proceed shortly to clause by clause. Thank you. We are suspended.
Can't hear you, Ron.
Sorry, I keep forgetting to unmute and mute. And apologies to the translators, by the way. I keep forgetting to mute myself. Anyway, so pursuant to Standing Order 75-1 and consideration of Clause 1, short title and preamble is postponed. So we'll call Clause 2 and understand that there is an amendment for Clause 2. I would invite Mr. D'Entremont to move that amendment.
Thank you very much, Mr. Chair. I move that Bill C-237 in Clause 2 be amended by adding, after line 21 on page 2, the following, quote, F, ensure that the Canada Revenue Agency is administering the disability tax credit fairly and that the credit, comma, in order to achieve its purposes, comma, is designed to help as many persons with diabetes as possible, period, end of quotes. Just simply put, there has been an ongoing challenge for people with diabetes to qualify for the disability tax credit. There's been a number of organizations that have expressed the difficulty. I can attest as a parent that it was probably third try before we were able to get it for Andre. So it was, I can imagine that for individuals that continue to have, are probably not as lucky as we are to be able to work for themselves and be able to get these kinds of things done. So just simply to try to facilitate the work and just to acknowledge that there is a disability tax credit there. I think it's sort of a very easy and calming kind of resolution without changing the intention of the bill. Thank you very much, Mr. Chair.
Thank you, Mr. D'Entremont. We carry on with the debate. We have Ms. Sidhu, please go ahead.
Thank you. Back to Mr. D'Entremont's passions. I do not oppose this amendment, but would remind committee members that CR is an arm's length agency for a reason. Not decisions to be dictated this type of decision. I do not believe that DTC regulation mention any specific disease or condition. My understanding that DTC is that it is meant to help people with a disability that impairs their ability to work or takes a lot of time to manage, like a significant physiotherapy. Not all individuals with diabetes meet this threshold. Regardless or whether an individual is eligible for the DTC, tax relief, or medical expenses, such as the cost of insulin, insulin pumps, and other supplies may be available through the medical expense tax credit, with additional support for low-income working Canadians provided through the refundable medical expense supplement. I know that diabetes can be expensive for some people to manage. I know that personally. And as the providers of healthcare, it should be the provinces that help fill that gap. That is why government will need to work closely with the provinces and territories to ensure that there is a clarity about what each level of government is responsible, that they are putting resources into the right program. But I once again thank you, Mr. D'Entremont, for his input and feedback.
Thank you, Ms. Sidhu. Mr. D'Entremont.
Yeah, no, I appreciate what Ms. Sidhu has to say there, but I think when it comes to the disability itself, there are a number of occasions where a person with diabetes has to take time off from work to attend doctor's appointments, treatments. If they do get sick, they have to take time off from work. There is a tremendous cost to diabetes beyond just the purchase of insulin or tests or those kinds of things. So it's just simply a friendly amendment to acknowledge that diabetes is a disease that requires a fair amount of time for the sufferer to be able to go forward. The other challenge that we have as well too, JDRF identified this as a problem back in 2017. There are still challenges from people trying to get the DTC. So this is a diabetes specific issue, and I hope that we can all support this as it goes forward. Thank you.
Thank you, Mr. D'Entremont. Ms. Rempel-Garner, please.
Thank you, Chair. And I just wanted to speak in favor of the amendment. I think it's common sense. Certainly everyone on this call or this meeting today would have had constituents call in with casework on this issue. It shows a good commitment to move forward on the issue. And certainly a colleague of mine, Julia Parsons, has made me very aware of this issue. So I thank you, Mr. D'Entremont, and I certainly will be supporting your amendment.
Thank you, Ms. Rempel-Garner. I see no other speakers, so we will carry on with the vote on the amendment. Mr. Chair, if you would, Mr. Clerk, if you would please conduct the vote.
Mr. Chair, if I could you please read the amendment back to me just for clarity? Just as a point of order.
Sure, I'll ask Mr. D'Entremont to do so, if you wouldn't mind.
Sure. It's an addition. It's just a clause addition to clause 2. So F, ensuring that the Canada Revenue Agency is administering the disability tax credit fairly, and that the credit, in order to achieve its purposes, is designed to help as many persons with diabetes as possible. End of quote. And I'm hoping that I'm hoping the clerk did share that with everyone.
I certainly do have a copy of it. So, okay. Is there any further questions or comments? Seeing none, I'll ask the clerk to conduct the vote, please.
Monsieur Cormier. Monsieur Cormier.
Désolé, j'étais sur mute. Oui.
Oui. Miss O'Connell.
Yes.
Mr. Pawlowski.
For.
Miss Sidhu.
Yes.
Mr. Van Bynen.
Yes.
Mr. Barlow.
Yes.
Mr. D'Entremont.
Oui.
Mr. McGuire.
Yes.
Miss Rempel-Garner.
Yes.
Monsieur Thériault.
Oui.
Mr. Davies.
Oui.
Mr. Chair, nays pour 11, 11. Nays contre none, 0. 0. Okay.
Thank you, Mr. Clerk. The amendment carries. So we proceed to clause 2 itself. Shall clause 2 as amended carry? Do we need a vote, or can we do this on division, or is it unanimous? Is there anyone opposed to clause 2? So I accept that as a vote, a unanimous support for clause 2. So clause 2 carries unanimously as amended. Shall clause 3 carry? I'll ask any dissent. Is there anyone who dissents? Seeing none, I declare that clause 3 carries unanimously. Shall clause 4 carry? Is there any dissent? Seeing none, I declare that clause 4 carries unanimously. Shall the short title carry? Is there any dissent? Seeing none, I declare that the short title carries unanimously. Shall the preamble carry? Is there any dissent? Seeing none, I declare that the title carries unanimously. Shall the bill as amended carry? Is there any dissent? Seeing none, I declare that the bill as amended carries. Shall the chair report the bill as amended to the House? Is there any dissent? Seeing none, I declare that the committee has determined that the chair shall report the bill as amended to the House. Shall the committee order a reprint of the bill as amended for the use of the House at report stage? Is there any dissent to that? Seeing none, I declare that the committee has agreed that the committee shall order a reprint of the bill as amended for the use of the House at report stage. That all being said and done, congratulations, Ms. Sidhu, on the successful passage of your bill, and it'll go back to the House at this point. I will be able to report this to the House, I believe, in the next sitting, which will be in 2 weeks. And then it will go back into the, for this report stage and third reading process for private members' bills. But congratulations. We will now proceed to the consideration of the report from the subcommittee. I believe we need to to ratify the report from the committee. I believe the clerk has distributed to all members a copy of the subcommittee report. In general, we proposed that for the NDP portion of the current study, the first round of topics for this COVID-19 study would be 4 days, and similarly for the Bloc Québécois study as well, 4 days, and that following those two portions of the study, we would schedule the two remaining meetings of the PMPRB study for Mr. Thériault. And in that process, prior to May 31st, we would invite the minister for main estimates. May we have I see, Mr. Thériault, you have your hand up to speak. Is that on this matter, or is it on another matter?
It's on another topic. It has to do with motions, the routine motions that I've tabled the other day. I have nothing else to say on the report.
Mr. Davies, I see your hand up as well. Is that also on another matter, or is that on this particular matter?
Moi aussi, c'est une autre sujet.
Okay.
It's under topic.
We will recognize both of you after we deal with the report from the subcommittee. So may I have a motion to adopt the report from the subcommittee? I don't know if I need a motion for that. So I see Mr. Van Bynen is making such a motion. Is there any discussion on this matter? Seeing none, I shall invite we shall vote on the matter. Is there any dissent to accepting the report from for ratifying the report from the subcommittee? Is there any dissent? Seeing none, I declare that the committee has adopted or ratified the report from the subcommittee. Thank you all. So we will go now to other business, and we have Monsieur Thériault. Please go ahead. You wish to move your routine motions?
Oui, Monsieur le Président,
Mr. Chair, I have put forward two routine motions. Today, as it was done in other committees, I'd like for us to adopt them. Here, I will read it slowly. The first one has to do with translated documents from the Translation Bureau. And it says it goes that all documents put forward that all documents submitted to the committee for business be sent for prior linguistic revisions by the Translation Bureau to ensure that all committee members can work equally effectively in the official language of their choice. Should we deal with this motion, or should I propose both motions? Mr. Chair?
With them one at a time. So I accept that you've moved that particular motion, and I'm not. So your wording is not quite what I'm seeing in the motion itself. So I will read the English portion of what I see, which I believe is the motion we're dealing with. That all documents submitted for committee business that do not come from a federal department or that have not been translated by the Translation Bureau be sent for prior linguistic review by the Translation Bureau before being distributed to members. Is that is the motion you're moving at this point?
La traduction était assez fidèle à ce que j'ai.
Yes, it was very similar to what I've read in French.
So that is the matter before us at this time. Is there any
De toute
discussion
façon, Monsieur
on
le
this
Président,
motion?
vous avez déjà
Mr. Chair, you have the English version and it says the same thing.
Wasn't quite clear that that what I was hearing you say was exactly that motion. I was listening to the translation, and there may have been a little difference. So, so I have Don. You have your hand up still. Is that on this? No.
No, that's on the other subject, Mr. Chair.
All right. So, Ms. Rempel-Garner, please go ahead.
Thank you, Chair. I support the substance of this motion. I would just ask for a small amendment that deals with the fact that members' offices often put forward routine communications to the committee that we do translate. But just given resources in members' offices, I would move to amend the motion to add the words "a member's office" to the motion so that the motion reads as follows: that all documents submitted for committee business that do not come from a federal department or a member's office or that have not been translated by the Translation Bureau be sent for prior linguistic review by the Translation Bureau before being distributed to members. It's my understanding that this amendment has also been moved, I think, at every other committee as well and has been accepted.
Thank you, Ms. Rempel-Garner. So the discussion at this point is on Ms.
Monsieur le Président, je pourrais
Rempel-Garner's
même l'intégrer.
Chair, I agree.
I don't get confused. So is there any discussion on this amendment?
I think he accepted it as a friendly amendment, if I'm understanding.
A friendly amendment doesn't really exist, so it's yeah. So let's just have the vote on the amendment. So I don't see any hands up for discussion. So if we can go ahead right now, is there any dissent from accepting this amendment? Seeing none, I declare the amendment as carried. So we go back to discussion of Mr. Theriault's motion as amended by Ms. Rempel-Garner. And is there any further discussion or amendment on this motion? Seeing none, I will ask if there's any dissent. Seeing no dissent, I declare that this motion carries. Mr. Theriault, you have another amendment?
Mr.
Oui,
Chair,
Monsieur le
just as a
Président.
point of order,
Alors,
we're dealing with motions, and Mr. Theriault having moved one motion, I believe it would then come to me next for my motion. I don't think one member can continue to move motions without without recognizing an order.
I guess Mr. Theriault wanted to move his both motions together. I suggested that he could do so. He should do so individually. But if Mr. Theriault wouldn't mind waiting, would that be okay, Mr. Theriault?
You know what? In this case, I'll defer because I think they're thematic. But just for purposes of process, next time, I think each member has a right to move a motion at a time, and I think that just so that keep that. But I think in this case, I'll waive that and permit Mr. Theriault to go second because his motion's.
Thank you, Mr. Davies. I shall also check with the clerk, to
Bon,
refresh my ideas.
I thank my colleague. And thank you, Speaker or Chair. Now, my next motion is about sound tests for witnesses. That the clerk inform all witnesses to appear before the committee that technical tests will be conducted by the House administration team that they must in fact take place in order to ensure that the technical equipment and internet connection are good in order to have the best possible internet quality, and that the chair inform the committee of any witness who has not done sound tests. I know that sound testing is conducted, and I know that things have improved throughout this past year. Yet, sometimes during meetings, interpreters comment on sound quality. I listen to the interpretation almost all of the time. I feel that this motion should be adopted. And I want the chair to inform us right at the beginning of the meeting if a witness has not done sound tests. We need to do some work ahead of time so that we can use our meeting time effectively. For example, sound tests of witnesses. We in the bloc feel that this should be a routine motion. Thank you. Thank you, Mr. Thériault.
Mr. Thériault's motion. Seeing none, I see Don's hands up. That's for the next thing? Okay. All right. I would advise Mr. Thériault that absolutely the clerk makes every effort to do exactly this, and you know, it certainly is one of the reasons why we need substantial notice, several days notice in order to bring witnesses forward. In any case, seeing no further discussion, I will call a vote. Is there any dissent on adopting this motion? Seeing no dissent, I declare the motion carries. Thank you, Mr. Thériault. We'll go now to Mr. Davies. Mr. Davies, I believe you have a motion to move as well.
Thank you. Yes, at the subcommittee on agenda, all parties had a chance to discuss, and I think I can speak for us and say agree upon our desire to have this motion pass at the main committee. For members' benefit, because it was quite a while ago, and for new members, on Tuesday, February 18th, 2020, we passed a motion that essentially would permit the chair to have the committee, I'll back up, that would have the committee re-adopt reports from the 42nd Parliament, which had already been adopted and submitted to the government in the last Parliament, but for which we had not yet received a response from the government. There were 7 different reports, including on the diabetes strategy for Canada, on tackling the sports-related concussions, on the impacts of methamphetamine abuse in Canada, on Canada's young Canadian exercise and health, on the LGBTQIA2 community's health, on violence facing healthcare workers in Canada, and finally, there was a letter that was written to the Minister of Health and Minister of Public Safety and Indigenous Services requesting a response to a letter written by the chair of the Health Committee dealing with the issue of forced sterilization of women in Canada. All of those issues, by the way, I think are still quite current. So I'm removing that motion here today. Everybody's received notice of it. That would simply permit this committee to re-adopt those reports and then permit the chair to table those reports in the House so that we can hopefully get a response from the government on those reports that represented the hard work of the committee last time, and most of which, if not all of them, I think were passed unanimously. Thank you.
Thank you, Mr. Davies. So we actually have 7 motions here. I don't know if there's a procedure to adopt them all at once. Is there any discussion on these motions in general? Let's see what the temperature of the room is on these motions in general. Everyone has had a copy sent by the clerk. Is there any concern or question about this? Seeing none. Mr. Clerk, is it would it be appropriate to adopt all 7 motions in one fell swoop?
If we have unanimous consent, yeah, sure.
So do I have unanimous consent of the committee to adopt these 7 motions in one go? Is there any dissent? Seeing no dissent, I declare that these 7 motions carry. Thank you all. So when we passed these motions, a year and a bit ago, I know that the Conservative members then on the committee had concerns that they might want to submit dissents. And I had advised them that I would give them notice before I tabled the report. And so my intention now that this has passed the committee is that when we get back after our 2-week constituency interval, that I would table these in the House at the first opportunity. So if there's any will to do a dissent, that would be the time I believe that you would need to be present in the House to table that dissent. And is there any further business to discuss? Seeing no further business, I think we are adjourned. So I thank you all, and have a productive constituency 2 weeks, and I'll see you all in a couple of weeks. So thank you all. We are adjourned.
Have a good one, guys. Sonia, congratulations.